What is unique about pregnant women in traumatology? Earlier, when a female with pregnancy ever entered to my emergency department, I used to feel so odd. Also, the ignorance of handling a trauma situation involving two individuals, whom to save, and all that, those kind of stuff. To the contrary, it is very easy. Just being aware of the facts helps us solve many issues. Pregnancy by itself causes various anatomical and physiological changes that may alter the natural history of trauma. A clinician needs to treat two patients, but prior treatment of the pregnant woman may prevent the further deterioration occurring in the child. X-ray may be required to establish a diagnosis. The help of an obstetrician is required to manage the patient. The changes during pregnancy being hormonal, every organ system is affected. Now looking at the diagram, we can see that at 12 weeks the level of the fetus is merely in the true false pelvis, and during the 20th week it touches the umbilicus, and further after the 28th week it is almost touching the sternum. Also in the other diagram that we can see easily, the amniotic fluid gains access in the maternal blood. Also that may be a possibility. Also we can see that the fetus has displaced the intestine of the mother upwards towards the diaphragm. So basically there is the fetus is suspended in amniotic fluid. If the amniotic fluid gains access in the maternal blood, it may cause DIC and amniotic fluid embolism. In the third trimester, the head is in the pelvic brim and may cause a skull fracture if there is an impact to the maternal pelvis. Also, it may lead to detachment of ureteroplacental interface known as abruptio placentae. So basically what we can note is the level of placental vasculature that is so important, and it is encountered even during the time of delivery. It is quite sensitive to catecholamine release in maternal blood and in response to shock. This may lead to fetal distress. There is a physiological reduction in blood volume leading to physiological anemia. Owing to increased blood volume, a loss of liter of blood is not evident as hypovolemia. However, it is evidenced by an increased fetal heart rate. Normal lab values in pregnancy, you can see it clearly in the diagram. And also knowledge about the cardiac output, heart rate, blood pressure changes are so important. Cardiac output increases by 1 to 1.5 liter because of increased blood volume and reduction in peripheral vascular resistance. With this, I conclude this topic. If you have any queries, insights, or experiences, please feel free to write in the section below. Thanks for watching.